Hi, everybody. It's Tay. Welcome back to the PSW Podcast. Today I'm here with Tara, a current PSW in the field. Thank you for being here. We've just been chatting for about an hour before we hit record. So she's been here for a while. So thank you for taking so much time out of your day to speak with us today.
Well, at least I'm not outside being eaten by mosquitoes in my garden. So that's a positive.
I'm glad I could shield you from the mosquitoes by asking you to just tell me more about your life. Tara's a very cool background. I'm sure we're going to touch on it a bit in our interview here, but this was really, I say this in every single interview, I swear, but today I sat here for an hour before I hit record and just listened to all of her words. And I'm sure you're all going to have the same reaction once, we dive into this. You articulate the field very well. You're just very driven, very passionate, and I'm just feeding off of it right now. So let's just jump into it for everybody else.
You're making me blush, Taylor. You're making me blush.
I mean it. How did you get into the field? How did you initially become a PSW?
Well, very interesting story because I used to work in pre-hospital emergency medicine in the medic field. And then I shifted for life reasons to the airport, working with emergency services and pre-border screening, and COVID happened. And I really, even though I've always worked in either public health or public safety positions, I felt when every 90% of our workforce was laid off from the airport, I felt like during a pandemic, I'm sitting there wasting my skills. And the provincial government was paying for PSW accelerated programs. And people said, you've been looking to shift to working for one of your local hospitals in a healthcare profession and getting back into that direct hands-on healthcare role. Why don't you become a PSW? Because that seems to be what the hospitals are asking for, and not necessarily acknowledging previous experience or higher levels of stuff. So I jumped on an accelerated program. Luckily, I did get some exemptions, so that was easy, a little homework light. I had to do some prior learning assessments, but that was fine. I got to use my brain. Apparently, it's still there. And had to, dust off the homework brain cells. But I really enjoyed it because I got back into those things that I loved, which is giving care and all that, science, biology, and why we do things and the reason for doing it, and medical terminology, which I love. If I could be a walking textbook or dictionary, I probably would in another job. So anyways, I went through the PSW program at a local college and did my preceptorship in a long-term care facility. And the facilities that were being offered in partnership with that community college didn't have a place in my hometown, and I wanted to be closer. And I actually had already eyed up working at one of our local hospitals in Eastern Ontario. So I had already applied during my preceptorship to work at one of the local hospitals in what they call, a lot of hospitals call them PCAs, and not necessarily PSWs. Each hospital kind of has their own vernacular. So, and that's what I got hired on as, and I love it. It's totally my jam as a PSW.
I can tell just by the way that you talk that you just love the field. And I think that that's wonderful. And bedside has a lot to offer us, I think. I know it has a lot to offer me too. And I really enjoy being bedside. And like you said, just going back and the care that you provide for people is so important. And that kind of answered my next question too. It's like, what sector are you in? And you're in the hospital. But can you kind of tell me a little bit like how the hospital is for you, for maybe some people out there who are considering, working in a hospital setting or have that as their goal? Can you maybe give us a little bit of insight on how that is for you?
Well, in my preceptorship, I got to see that glimpse, that snapshot of long-term care. And as much as I love, we do the same thing every day, and then we just change the menu and change the activities, I found that it didn't really feed my own need for, wouldn't even say adventure, given that when I used to provide care in an ambulance, it was a different day every day, regardless of what our constraints of our healthcare field. So I find that at the hospital, every day I could have a different list of patients. The patient that was in the bed yesterday could have been discharged while I was home, or I come back to my next shift a couple days later and it's a whole new floor. And I kind of like that. I mean, I find it's a value added. I can use my skills to help really sick people. So a lot of my work is on a med surg unit, a medical surgical, and I love it. I mean, I have patients who are somewhat independent. I have patients who are total care. And sometimes I'm doing their morning cares. Sometimes I'm helping them feed them or helping them feed themselves, because independence is a huge thing, getting those skills going. But it's a value added. And at the end of my shift, I'm dead tired. But I feel like if I stop and ask myself, did I give the world something good today and use my skills for good? I can say yes after every shift. It's kind of the whole like Spider-Man adage of with great power comes great responsibility. So I feel that healthcare providers of any sector, we have the knowledge, the skills, the training to help people in need. And as a PSW, there is so much we can do within various sectors of the healthcare field. And I love working in a hospital because every day is a different day. One shift I could be in the CAS clinic working with an orthopedic surgeon, directing traffic, helping put casts on and off, sending people down to x-ray. It's kind of a PSW light function. Sometimes I could get borrowed down to the ER and a coach come in, you could be doing CPR with a team of nurses and doctors. I could be providing care for admitted patients in the ER. I could be upstairs in a convalescent care area or a long-term care area. And so I still get that long-term care faction at one end of the hospital, or convalescent care, which is, usually up to 90 days in a program. But then I'm also getting acute care on the floor. So I'm kind of getting like the whole box of chocolates. You never know what you're going to get. And I like that, because then I have variety in my work, and not every day I'm dead at the end of my shift, but every day I can end my shift and go, did I have an added value benefit to my day? Did I use my skills in a positive way? And every day working at the hospital, I can say that, because we have a lot of sick people who need a lot of care, and we need a lot of dedicated medical professionals of all scopes and practices to affect that care and provide that care.
And that kind of leads me into my next question here. You talk very, very well about utilizing scope. And I know before I hit record, we had a really nice discussion about that. So I want to ask again, where do you see the field, moving forward, and how do you see our scopes being utilized? If you could share that with our audience. Everything you said is just so lovely.
I find that depends on the sector that you're in right now, will depend on how utilized that scope is. In the community, our PSW partners are actually using their scope to sometimes its full extent and pushing those boundaries as we redefine our profession in Ontario. But I find sometimes in places like hospitals or other healthcare institutions, our scope of practice that we're trained for is not being fully utilized. And in a national, provincial, local, regional crisis of not having enough healthcare providers, I see that underutilization might be a key solution, and not just a Band-Aid solution. A lot of people go, well, that's great. We'll provide a Band-Aid solution for the lack of nurses. We need to cognitively reframe ourselves by saying that PSWs are not healthcare professionals. PSWs are working towards regulation, but we already act as professionals in the healthcare field. So if we were allowed and permitted and supervised to work within our full scope of practice, like doing vitals, doing a blood glucose value, which is an activity of daily living, other things that we could be delegated to do, we could have an added value to our RPN partners, our RN partners who are working in various other sectors that we work with them or alongside them. And I think that as a profession, we need to push for regulation. We also need to push that where we're working, use us to our full scope. Because as I like to say, we have a shortage of people. We can't just magically create a bunch of PSWs, RPNs, and RNs. So if we can't magically create more of us, don't cremate anyone. Thank you. That is another delegated act for a different profession. If we can't create more of those healthcare professionals, then we have to look at the toolbox that we have. We have to look at the staff we already have and go, okay, what can we do? How can we reframe? How can we use those professionals to the best of their ability? How can we reframe their scope of practice and work within what we have? So if we can't buy new tools or more equipment, we need to use the equipment we have in the best way and in a better way. So where that kind of boils down for PSWs in Ontario is that once a regulation can take place, then we have that list of delegated medical acts. We have that scope of practice. We have that regulation. And it allows places like hospitals that require that regulatory body to keep because that's a safeguard for patients and our clients and the people we're providing care for. It's also a regulation for us so that we're not being asked to step outside of our scope. So I think that the best way forward is for all of these agencies and employers to really look what they have in their toolbox and use the tools they already have in hand better. And that's where we need to grow as a profession. And that's what we need to push hard for. We need to stop sitting on the back burner going, I'm just a PSW, and go, I am a PSW. I have value. I belong in this team. And this is what I can help the team do and accomplish.
Music to my ears. That is so great. That is so great. It's very true. And I think we often get pushed to the back burner or, told to shush, and it's really holding us back, I think, in the grand scheme of things. And you're talking about vitals even, when I went to school and I graduated in 2016, I learned how to take vitals and I never did it again because I was basically told, you don't do that. You don't do that anymore. But it's like, I'm very capable of it. Why can't I? It would help someone out in the long run. So it's just a little wild to me, even that there's such a disconnect with some of the stuff we were even taught and how it can be implemented into our work lives.
And with no offenses to nurses, but I find that the majority of the teaching staff within our PSW programs in Ontario are actual nurses. So their perspective of what we can and can't do, as we were talking earlier, we're more often told what we can't do instead of being told what we can do. So we're focusing on the negative instead of the positive. So if we stop focusing on the negative and what we can't do and focus on an added value approach, where what is this person trained to do? What could they do? Because what RNs used to do and what RPNs couldn't do are now very different. Even if you just look back 5 years, let alone 10 years, 15, 20 years ago. And PSWs are now, if you look at what PSWs were able to do 15 years ago when they were taking a 6-week course and doing, 3-week course, 6-week course, 9-week course, that was the end of it. We're now looking at a full year college program, and they're getting labs, they're getting clinicals, they're getting signed off on these delegated acts. So why are we not then taking that training and then actually using it in the community, using it in hospitals, in care homes, use the added value approach? So I think we can really utilize these skills. So why are we training them to do these skills and not using it? Because we have that term regulated staff, and it drives me nuts. It's like, oh, the following meeting or the following training is for regulated staff, which automatically means not PSWs or not our PCAs. It's only for RPNs and RNs, which is fine because it might be actually for their scope. But we need to remove that term because pretty soon regulated staff will include PSW. So we need to change the language even so that we're not creating that divide. I think that'll be a huge one, is when people go, oh, it's only for regulated staff. Hello, I'm a regulated health professional now. So I think that's going to blow the minds off a lot of people and force them to rethink how they view PSWs as professional healthcare providers.
Well said. I just eat up everything you say. It's just it's so true. Everything you say, it connects, and it's like, yeah, why aren't we being utilized? Why is there such a divide? Why are we put in boxes in the first place when really we're taught elsewhere that we can be outside of the box? It just doesn't make sense. And it's really nice how you can address that so eloquently for our viewers, and for me too. Like, it's very nice to hear you speak on these issues, and hearing about your passion in the field, and your drive to work, and how you utilize your prior knowledge in your job now. Like, I really do feed off the passion that you're putting out here, and it's really wonderful to listen to, and I'm sure our viewers and listeners feel the same way. I'm going to ask you now too, the thing I've asked everybody, if there was one thing or a piece of advice that you could give either people thinking of becoming a PSW, or current, grads that are in school, current students that are in school, not grads. I don't know why I said that. Or, new grads. What would you say to new PSWs?
Recognize your value. We have hierarchy in the medical field where everyone is at their post. Recognize that you are at the ground floor of something that we've been working on for decades, that you are at a really exciting time in our profession. Recognize your value, because you have no clue how much value in the training and the skills that you hold right now within our current state of our healthcare system. Don't let others undervalue you, because very soon people will be forced to recognize your skills, your knowledge, your judgment, and what your added value is to our profession. So go find your niche. If the first thing you try doesn't work, it's not your jam, try another area. There's no harm in trying a different employer or a different setting. Even if it's just for a probationary period, find what lights your fire and run with it, because we're at a very critical time right now where we need you, and your skills are so undervalued, but they're about to be lit up like a firecracker, and everyone's going to see that you have a place at the table. So hang in there. Good things are on the horizon, and just understand that you are so vital and important to us right now as a whole. We're not individual parts. In medicine, we are all one. And sometimes we don't think as one, but we're getting there, okay? We realize in a shortage of staff that we all have to rely on each other. So you may feel like you're coming into healthcare at a really desperate time, but you're coming into healthcare at a really exciting time for PSWs, because we have big things coming. So hang in there, find your jam, find your niche, and then run with it. If you want to build on that and move up, that's great, but don't undervalue your position as a PSW. PSW isn't always a stepping stone to nursing, because PSWs in themselves are a profession. They have value and they have a place. So don't always think, this is just, the law of the low step. No, you're here and we need you. We love you. And just thank you for being here. You are appreciated, you are heard, and you are seen.
Mic drop. Boom. Happy PSW week to that. Okay, amazing. Thanks. I mean, I'll just end it here. I'm just here at this point. Yeah.
Well, let's see, there's a
Uh,
mic here somewhere. If I drop it, I'd probably break it.
we should have you back just for like TED Talks, like inspirational talks on here, because I'm telling you, I can't be the only one here listening to this conversation that's like, holy cow, like what? Like, who is this person? Who is she? It's, yeah, I'm not going to repeat myself again, but this has been chef's kiss. Wonderful.
Call me anytime, Taylor.
I'm
Call me
serious. You should just
anytime.
come back. Like, you should just come back. It made me feel good.
I wish I had more time to like jet off and join you guys at like conferences and stuff. It's really it's really time consuming. Like the Life Saving Society flies me to Toronto just because it takes like 5 hours to drive to Toronto and back, 4.5 in low traffic. And just so I can get back and not have to take time off work. I wish I was closer so that I could attend some of these places where people are testing out the field, because I feel that people need to stop being told. I'm sorry, my husband just walked in and showed me his t-shirt and I totally scrolled. And I have to stop being told that PSWs is a stepping stone, because that language undervalues us as a PSW. It cognitively tells us that it's a less than position instead of it's a PSW. It's a job, it's a career in itself, and it can be a lifelong career. It doesn't just have to be a stepping stone to nursing, which it's a great way to develop nursing skills. But I think by marketing it as that, it undervalues our profession and what we're capable of. So we need to change the language. We need to change also the vernacular of, registered staff. Changes are coming, but we need to force it. We need to be a voice that's heard. Sorry, you're hearing my espresso machine right now.
I can't even hear it. I can't hear it.
I can only live off two things. They're inversely proportionate: caffeine and sarcasm. When the sarcasm is high, the caffeine is low. They're inversely proportionate. Some people would just argue I'm sarcastic all the time, but anyways, I digress. We need to change the language. So as we forge forward as a profession on its own legs, we need to change the discussions. We need to change how we cognitively frame PSWs as a profession in its own right. We're not just a stepping stone. We are not just there to brush teeth and wipe bums and change briefs and pull-ups and all that. We have value within the care system, within the community, within hospitals, within long-term care homes, and everywhere in between. If we look at models from a European model where they keep people out of hospitals and they don't have long-term care homes like we have, because we have care being provided in the community. If Canada were to be able to move towards that model and use our PSW partners as community healthcare providers in a greater numbers, we would be keeping people out of hospitals. We would be keeping people who don't need to go to hospital by ambulance because they've become so sick due to lack of care, where they could stay home in their own house. So, on the precipice of the new horizon of PSWs in Ontario and hopefully Canada-wide, we need to understand where we're at. We're in a really critical time right now to elevate ourselves and to really understand our value and where we could grow as a profession with what we have. So telling those new people, like, we need you, we have a place for you. You want to work in people's homes doing this? There's a place for you. You want to work in a hospital? There's a place for you. You want to work in long-term care? There's a place for you. And guess what? There's about 15 other places you could probably work that you haven't even thought up yet. Children's facilities, homes that have people with cognitive and physical deficits who are living, as adults and just need that extra help and care. Like, there's so many different facets of healthcare. and we are applicable to all of them. So find your niche and run with it.
Love it. Love it. Speechless. I'm a big fan. I'm gonna end it here. I don't there's no better, you can't get any better than this. So
Maybe I could, pack up my banjo and drive all the way to the big city someday for a conference or for to inspire new colleagues. It's just, I literally live in the middle of nowhere. It's funny how close I live to Ottawa and I live in the middle of nowhere.
I would love that. I would love to have you back sometime too, just to maybe pick your brain about specific topics too. It's been really wonderful. I mean, thank you for the almost 2 hours we've been talking. It's been amazing. And I hope that everybody listening got to take something away that I did, because this was lovely. So thank you again for spending the time to talk with us and just being so powerful. I don't know, it's a Zoom call, but it's very powerful, and everything was just great energy. So thank you again, Tara.
It gave me a chance to wear real clothes today. I could have been in scrubs from the hospital. I was very glad I wasn't called back in for a third extra shift this week.
I'm really glad that you got to bust out your regular clothes. That's what it's like sometimes. You're like, oh, these aren't my scrubs, or wearing hard pants, like jeans or something, and you're like, whoa. Yeah.
Well, I have glasses and I wear a hearing aid. So and I worked through SARS, but I didn't have a hearing aid when we worked through SARS. So PPE, I was comfortable. I use that term lightly, comfortable wearing N95s before, but used to wearing them. But when we started doing, face masks all the time, I had a real hard time not having ulcers on the back of my ear. So I wear scrub caps all the time now, no matter which job I'm doing at the hospital, and they have buttons on them. And now if I'm at work and I don't have a scrub cap on by accident, I feel naked. So it's my new uniform. I wear scrub caps everywhere. They're like, you're not working in the PACU today, because I sometimes help out in pre and post op, which is another PSW thing you can do. And the thing is that, but the rest of the hospital, you didn't have to wear a scrub cap. And I was just like, I'm naked. I don't have a scrub cap on. So all of my colleagues who met me during the pandemic, and I'm just going to kind of put my phone right here for a second. They know me from here and here. So if they see me in the community, they're like, I didn't know that was your color of hair, or like they're now seeing my whole face instead of literally just my glasses. So some people go, I didn't know what your face looked like. It's even worse when you wear a scrub cap all the time, because literally they just see your eyes.
Just get the slits. That's it. Yeah. I had the same thing. I didn't even know what some of my coworkers looked like. And I've been working next to them for how long? It's crazy. It is a crazy time. But yeah, I can relate. We have sore ears too. And
buttons are our friends, people. Buttons are our friends.
They really are. I never thought of like, wow, that's such a simple thing, and it does so much for us. Just a button on your cap. Yeah. Well, thank you all for being here and for listening. And thank you again, Tara. And I hope you all have a fantastic rest of your day. And thanks for tuning in. Bye, everyone.
Thanks for having me.